Hey guys, it's Dr. Niro here from Ignite Medispa. We've got Nadine and Mitch who are here with us along with Dean, and they're kindly sharing their thoughts and experiences regarding the wellness program. Mitch has had cosmetic surgical procedures in the past, but he's been describing improvements in his function, his thinking, and just general quality of life. So we thought it would be very useful for our listeners to get some insight from Mitch regarding how these aspects of his life have been touched and improved by the wellness program here at Ignite Medispa. So Mitch, thank you again for being here. Over to you.
Okay, then well, I'd just like to start off just saying that the whole program that I've been a part of, it's had a real holistic approach to it. So it's the science-based from it which makes it so unique, but also some of the effects that I've been experiencing since I've lost the weight is I've just got more energy. I wake up in the morning and I'm very much a clear thinker, and it's just been simply the best thing that I can say has happened to me in recent times.
Dean, typically with patients, of course, there is a cosmetic aspect once they lose weight and as the body's shape or contours change. But functionally, what do patients typically report to you?
Functionally, people report initially dramatic improvements in sleep quality and how they experience waking up in the morning. People actually experience waking up, which is a new phenomenon for many people. There's a reduction in inflammation. What this often results in is the disappearance of brain fog and the lethargy. So after a few weeks on protocol, even though strenuous exercise isn't required, in fact you don't have to do any exercise, I often find people saying to me, Dean, I just feel better, I want to move more, can I start exercising? That's when I do ask them to start to introduce some walking regularly. You could do yoga, stretching, all that sort of stuff, just nothing strenuous. Functionally, it makes a difference in terms of joint pain as well. So joint pain, and in particular osteoarthritis, is the #1 leading cause of pain and disability in Australia. It's so common, particularly as we age. Women tend to experience osteoarthritis more than men, but there's really nothing you can do about your age or your gender. However, obesity and states of overweight really is a major risk factor to the development of these degenerative disorders like osteoarthritis. If you have excess inflammation in your body, which is generally caused by the excess fat around your belly, this can increase the tissue degradation in our joints. So what our patients often experience is relief from that pain and better joint function as well. It could make the difference between the requirement for a joint replacement surgery or not. So if you are thinking about taking on, transforming your health, losing the weight, etc., you really want to consider the benefits to your functionality and your joint pain and your experience moving forward into your older years.
It's very rare that people are able to give such meaningful and off-the-cuff reflections about their journey, and all too often with a lot of videos there's a lot of splicing, interruptions and punctuations, but Nadine and Mitch have done this in a very professional manner. You guys should think about doing a lot more of these, and Dean, of course, you are always a wonderful speaker, and I hope that all of our listeners have found these insights to be very useful and not just educational but informative about how things will integrate into their lifestyles. So thank you once again to everyone, and we welcome you to Ignite Medispa at Wollongong Private Hospital. Thank you.